Hi, my name is Savannah Stowe, and I'm here to talk to you today about my internship experience this semester with Island Cardiology. Island Cardiology is a private practice that is located in Carolina Beach, North Carolina. It is mostly funded by patients and major insurance agencies. Island Cardiology focuses on treating patients with cardiovascular disease and other cardiac issues. Patients with high blood pressure, high cholesterol or heart disease, valvular disease, and congestive heart failure are great candidates to be a patient here. Also, if you are just in need for a second opinion, Dr. Brzezinski is always taking new patients to go over their previous diagnosis or other treatment options that might be available for them. Island Cardiology is under the supervision and practice of Dr. Damian Brzezinski. He graduated valedictorian from Johns Hopkins Medical School and graduated valedictorian at Harvard Medical School. After his time at Harvard, he trained in Europe for a little bit and then completed his cardiology fellowship at Duke University. After his time at Duke, he served in the Department of Cardiology at Wilmington Health for over 25 years. After retiring from Wilmington Health in 2016, he opened several nonprofits, including Keeping the Beat Alive, and started his own private practice in 2017, which was Island Cardiology. My internship was an in-person internship this semester, so these are the following were my internship responsibilities. I was able to observe and shadow Dr. Brzezinski with patients. I went on rounds with him periodically throughout the semester to learn how he communicated with patients and how he treated patients based on what their diagnosis was. I also was able to observe and assist in nuclear stress tests. With my EMT certification, I was able to record blood pressures and also able to assist in EKGs. I also observed EECP treatments, which stands for external counterpulsation therapy, which is a non-invasive therapy for certain cardiovascular diseases such as coronary artery disease. I also observed echocardiograms and was even able to scan a few patients if they allowed me to. I also assisted the office staff in any way that I could throughout the semester. There are two public health domains that I focused on this semester. One was identifying and addressing health challenges, and the other one was human health. For identifying and addressing health challenges, I would help identify the needs and concerns of patients, specifically with cardiovascular disease, and I learned how to identify and treat cardiovascular diseases. When I would go on rounds with Dr. Brzezinski, after each patient, he would sit down with me and debrief with me about why he chose a certain treatment plan for that patient. I was able to learn about different treatment plans for cardiovascular diseases and why certain treatment plans weren't good for some patients. Human health was the other public health domain that I focused on, especially being at a doctor's office. Of course, human health would be the public health domain that I focused on. So assessing each patient and treating them based on their heart disease, and also researching and choosing the best course of action for treatment for the patient. Internship highlights. Honestly, there are so many highlights of this internship this semester, but here are a few that I think were the top 5. I definitely gained a strong relationship with Dr. Brzezinski and his staff this semester. I learned about a lot of opportunities that I could seek after graduation. Of course, observing a board certified doctor is a huge highlight of my semester. While this was definitely not fun for some patients, witnessing real-life emergencies and how to handle them properly was a highlight, and how I could see how emergency services were used and what treatment plans were appropriate for the situation. Also, and this sounds a little cliche, but witnessing Dr. Brzezinski saving his patients' lives. I cannot tell you how many times a patient either said to me or to his staff that they would not be here today if it weren't for Dr. Brzezinski. The way that he treats his patients and the way that he uses different treatment plans for a specific patient has changed so many lives in the cardiology field. I think that what I liked least about my internship was that it was during COVID-19. And while I couldn't do anything about this, if COVID-19 was not happening right now, I would have been able to shadow a lot more procedures, including just cardio procedures in hospital or other procedures. But however, due to the pandemic, that was not allowed this semester. I do think that the most important thing that I learned this semester started on my very first day. I walked into the office and Dr. Brzezinski handed me a book on EKGs. While I have very minimal experience with EKGs, I do have a little bit, but throughout reading this book this semester and learning from Dr. Brzezinski and his medical assistants, I can tell you that I have been able to learn how to read EKGs and how to apply them onto a patient, and also how to work an EKG machine. My most memorable experience. My most memorable experience is definitely not something that I think you would usually hear. It is a personal experience, and it is when I, as an intern, became the patient. Over the past several years, I have had these fainting episodes that have come and gone throughout probably the past 5 or 6 years. And I've talked to doctors about it, and no one has ever run tests or has ever really thought that it was a very big deal until I had a fainting episode while I was at my internship a couple of weeks ago. Dr. Brzezinski jumped on it right away and told me that this is not normal and that he thought that it had something to do with my heart. So through a series of tests that I was given, I was diagnosed with what is called neurocardiogenic syncope, which is basically when I am not getting enough oxygenated blood to my brain that causes me to faint. This experience, as unfortunate as it was, it turned out to be the biggest blessing in that I am getting the best treatment from Dr. Brzezinski, and he has made it so that I shouldn't have any more fainting episodes ever again with the treatment that I am being given, which is a huge blessing to me and was also a really great learning experience, considering that I did get to learn firsthand how Dr. Brzezinski treats his patients and the ways that he treats them according to age or activity or anything like that. Final thoughts about this internship was that I truly could not have asked for a better internship this semester. Dr. Brzezinski has given me more opportunities than I could have ever hoped for. I definitely plan on staying connected with Dr. Brzezinski and the staff of Island Cardiology in the future. I think one of the most important things that I learned this semester while shadowing Dr. Brzezinski is that caring for your patients and listening to your patients are a lot more important than I think most doctors think. Dr. Brzezinski never makes a patient feel like they are in a rush or that they are an inconvenience. And that's one of the things that he taught me on the very first day that I observed him. He told me that no matter how busy we are or how busy the office is or how chaotic it may be, the most important thing is to make sure that the patient doesn't feel rushed. Because when the patient feels rushed, that's when mistakes are being made. Listening to patients, listening to their concerns is what will help the physician figure out the best treatment plan for them. And that's something that I definitely will take as my career grows in the public health field or when I plan on going to PA school. I think that I will carry that advice with me for the rest of my life. And here is a picture of the entire office staff. We had a little party a little while ago, and this is everyone that works for us and the people that have helped me begin my career in the healthcare field. Thank you.